Well, guys, this is fun. We're here kind of having a conversation about the Regenerative Procedures Institute. We call it the RPI. It's basically kind of a new platform for learning, which is going to be a combination of online learning combined with in-person training and having workshops and cadaver training. It's going to be amazing. And we all have different journeys to where we're at today. And what I think we can all agree on is really that the healthcare system, especially with orthopedics and pain, is really pretty broken. Let's just reflect on that a bit. What are you guys finding? Because we talk to patients every day that have been in the standard model of healthcare, and they come to see us in our clinics. And what do you guys feel is really broken? Where are the gaps right now in that current model of healthcare? Eric, do you have any ideas on where it's broken and how it got that way?
Yeah, I mean, I think maybe the easiest is that patients aren't treated like people. And I think in private practice, and especially when we're looking at kind of a customized approach to every single individual, they are in our practices, in mine, just loving that they're not just, kind of on an assembly line of 5-minute visits with a specialist and out the door, and then follow up in 2 months or 6 months or whenever they can get in next. And so that's a major issue in healthcare now. And I feel bad when patients complain to me about their PCP or about their specialist that didn't give them the time of day. And I say, honestly, I think those are great doctors working in really bad systems. And so just being in private practice is, a privilege really for me to be able to treat my patients the way I would want to be treated, and being able to treat them like a person.
Yeah.
I give, enough time, really look for the root cause of what's bringing them in. And
it takes so much time. I mean, to have somebody come in and say, I've got back pain, and to give them the diagnosis and a treatment plan, you can't do that in 10 minutes.
No.
And I think I get the same thing too from a lot of my patients is you actually listened to me for more than 5 minutes. You didn't automatically go to the knee replacement. You actually gave me some options. And what about you, Dr. Wang? What do you feel kind of is most broken in this model? I mean, you've been in this now for many, many years, 20 years, just like me plus. And what do you feel is what you found is broken? It's definitely changed over the years.
Well, to dovetail on what Dr. Phillippi was talking about, it comes down to that cruising control, unfortunately, the purse strings, and that determines how much time or how little time you have to spend with your patient. So, in the world of insurance-based medicine, when the insurance companies are the ones that say, okay, for this office visit, we're going to pay you X number of dollars, and that number keeps going down a little bit each year. Now the practitioners are forced to have to see that many more patients per unit time in order to just make ends meet. So now you have less time per patient, which means your quality of care is going to decrease. So now you have to find a way to break that cycle where you can offer treatments that are effective and diagnostics that are outside the realm of regular medicine, but also be able to financially survive and thrive, right? And so how do we find those combinations?
Yeah, and I have to admit to myself, 15, 20 years ago, I was part of the broken healthcare model. I was trained on the traditional, you have pain, cover it up. You have pain, give you the steroid shots. My toolbox was so small. I had 3 tools: write a prescription, do pain medication, or consult them to a surgeon. I think as we know, the healthcare model has changed a lot based on where things are trending, what the consumer wants. And I know both of you have made the same decision I made, is you've decided to go from the old broken system, that's all we're trained in, to this new model. We can call it the regenerative medicine model, the regenerative orthopedic model. And why did you guys personally decide to change from what you may have been originally doing, or why are you providing that for your patients now?
I had the opportunity to learn it, and as soon as I learned it and learned prolotherapy, as soon as I saw how patients responded, I was like, that's it.
Yeah.
And then I got it myself. I had 10 years of chronic back pain from an injury in high school, and I got my low back treated with prolotherapy, and it was the first time in 10 years that I'd been out of pain. And I was like, this is something. And so, I both experienced it, but then also watched patients go through the process and see that they were given regeneration, like more tread on their tires, right? Turn the clock back on the wear and tear. And, they're doing the things that they wanted to again. And that's the kind of medicine, to talk about the broken system, that I wanted to provide, right? I went through a primary care residency, and in family practice, like my hope was to restore wholeness. But all I was doing was writing scripts and because of the system I was in, so having that tool of regeneration for ligaments, tendons, joints, and letting the, dad get back down on the floor with his two young kids that he couldn't have bent down for before. It's awesome.
It's amazing. Yeah. I think the three of us have a similar story in the fact that we were introduced to the Hemel Haggett Patterson Foundation. For me, that's really the pendulum shift for me. As I went to this conference and I was like, wait a second, there are different options for us. And back then, 20 years ago, it was prolotherapy was the options, and that is expanding as we go. And so that really opened my eyes up. Dr. Wang, when you talk about, you had a different training, like you were actually trained in regenerative medicine as part of your fellowship program, I believe, right?
Kind of, yeah. So, well, basically, I, as a DO, as an osteopathic physician, I've always gravitated towards so in osteopathy, we have these tenets of osteopathy, being that structure and function are interrelated. All the body systems are interconnected, and that the body has a self-healing capacity. So regenerative medicine fits perfectly with that because we are basically enhancing the body's ability to heal itself, right? So with that as a background, I was fortunate enough that, I'm in physical medicine rehabilitation for my residency at Harvard Medical School, and our medical director there was just like a visionary enough to bring on the regenerative piece and the musculoskeletal ultrasound piece early on. So as a resident, I got to start to train in some of those things, right? And it's fantastic because it just opens up this entire new avenue of diagnostics and treatment. And the traditional, even at Harvard, the traditional musculoskeletal training was good. It was solid, but it was just different than what you pick up with the regenerative piece. One thing that people talk about in the US is that every other medical specialty pretty much has like a medical and surgical counterpart, right? So you have like cardiology and then cardiothoracic surgery. You have gastroenterology and then, a general surgery with GI. But in orthopedics, it's not really like that in the US. You just have orthopedic surgery. And now there is this shift to orthopedic medicine, which is those non-surgical interventions like what we focus on. And I think that it just provides this incredible avenue for patients besides surgery, and now you bring the regenerative piece on top of that, and now we can help them heal.
Yeah, it reminds me, and there is a shift happening. No matter how you look at it, there's a palpable shift in what the consumer is wanting. They're becoming more educated on their options. And you're right, in the past it was like, oh, we have a surgery or we're going to cover it up. And now there is this shift. And why do you guys feel there's such an important need for this shift, especially in the training of how we train us as the providers? Because I think there's still a bit of brokenness in the training system as well. But let's talk about why a shift is needed.
I was just thinking as you were describing that, as a primary care doctor, patient came into me with knee pain, and I love procedures. I love helping people. I like to provide that fix. My tool is a steroid injection in primary care.
Yeah.
And at first that was just awesome. Like, I want to help this person. I'm giving them pain relief, but I didn't have the longevity with those patients to see what happened later. You're in pain, I can get you out of that. But I'm with that patient next year after that, and they're off to surgery with worse pain as soon as that steroid wears off. It's like, did I actually help?
Yeah.
Shows that the data says no, I actually caused that surgery to come earlier. So ethically, doing the right thing for the patient, I'm like, you're in pain now. Previous to having regenerative medicine as part of my toolbox, my only tool is let's cover it up, like you said, with pain medication, or let's send you to surgery. And it's awesome to have this bridge where, in fact, we can, if at worst, we push surgery off. But in many cases, patients don't need surgery to replace joints when we're treating them at the right stage of their disease process. And it's fun to provide that. Patients love getting that back. It like brings joy back into the mix, which is great.
Yeah, absolutely. I think that there is a slow shift in the educational programs, like the residencies, and now even in the medical schools, there are some, a handful of medical schools that are bringing on the diagnostic ultrasound early in the gross anatomy courses. But there is just this huge need for education on these things because we can't have it soon enough. We have all these patients that maybe are not heading quite in the most optimal direction, for their well-being and for their care. So the faster we can train, doctors who have that interest, they have that thirst for that what is that thing that they're missing? What is it about everything from just how do I diagnose this person with low back pain that I can't figure it out and I don't want to send them surgery to, well, they've got this knee pain and the steroid injection didn't work. Now what can I do, right? And so to have a training program or training institute that is readily available for these docs, multiple specialties, as long as they've got the good background and they're motivated, whether they're, orthopedic surgeons or family medicine doctors or physical medicine or anesthesiology, radiology, whatever, all comers, as long as everybody has the same goal and learns responsibly, and we have a training program that has the highest quality, the highest level of training out there. Hey, now you've got a recipe for success.
Yeah. I think about truth. Like once you know the truth about something, you can't go back. So for a paradigm shift in my mind, it was, oh my gosh, once I started reading the research on steroid injections, the effects it has on soft tissue, the effects it has on cartilage, the effects it has on our body's ability to repair itself, dang it, I can't go back to the one tool I had in my toolbox, right? So I had to evolve, I had to emerge. And I'd be really curious to hear your guys' journey because we talked about it. But for me, it took me 15, 16, 17 years to become proficient at where I'm at today. I still feel like I'm a student. I still feel like I'm learning from you guys in the collaboration at some of these events. But reflect on that because it takes too long to become proficient. I mean, that's part of the goal with our RPI is to say, okay, guys, give us a year, give us some time. We can get you there in a year's time frame, which is a very tough, steep goal for us to provide the service to people. I think we can organize it well enough to do that. But tell me about your guys' evolution. How did you learn what you're learning, what you do today? Because it is pretty amazing the stuff you guys are doing.
For me, I first learned prolotherapy from my predecessor in my practice. I took over private practice from Dr. Owens. He taught many people prolotherapy, and so I got to work with him side by side. And then getting to go to the Hemel-Patterson conference, and then really quickly coming to Rejuve MedFit conferences.
Yeah.
That was the journey for me, is just be in with experts at conferences, and then take a pearl that I felt I could use that in my practice and integrate that into my practice. And it's a long journey. It really is, because what I never wanted to do was be out over my skis. I never wanted to be in that situation where it's like, I have this patient and I know someone can help them, but they're with me. I could try. Like that never felt good, And so being able to make sure that I was credible before I was incredible was important, right? And just that foundational piece of, yes, I can inject a knee. Yes, I can now inject it with dextrose instead of steroids. Or yes, I can make PRP the right way. I know how to figure out which kit is right. And now I can inject that. And sure, I might not have started with a cervical spine, but I got there with just building that foundation of the kind of those safe, effective, easy steps, and then building on that just one patient at a time. But being around experts, it's wonderful that you say that you are still a student and have so much to learn. I mean, that's what makes you a great teacher. And being around like-minded folks, having the opportunity to ask questions, right? And being in a community where I can ask you a question and I don't feel silly asking them, because all of us have been there. And also the way that, you answer questions, it's just, we've got a good group to share. Absolutely. I remember when I was asking that same question, and I've got something to share now.
I think what makes all of us good teachers is we were all very astute students. Like we weren't okay just hearing. We had to learn it and do a repetition and learn it. And my journey is the same. I felt proficient coming out of fellowship at my MSK, my exam skills, and I could do that. And I could find the joints and inject them blindly. And then I went to the HHFPF conference, like, whoa, I have so much to learn. It took me another probably 8 years to become proficient at palpation-guided injections. And where do I go and where are the arteries? Is like, okay, I finally learned it all. And then MSK ultrasound comes out 12 years ago. I'm like, I'm a student. So then you obsess and you learn and you grow. And then, 5-10 years later, you feel like you've mastered it. But then now there's the fascia, and then there's the nerve hydrodissections. And now we're getting into fluoroscopy-guided procedures. So it's an evolution. It's always growing and expanding. That makes us love what we do, because our toolkits are now 30, 40, 50 things we can do to make our patients better. Now that you all obviously are highly skilled, you're providing these amazing procedures from prolotherapy up to bone marrow harvest and fat grafts. What else have you learned in the last 5, 10 years that you blend with these procedures that are optimizing your outcomes? Because we can be amazing at injecting, but there's so much else we can do to optimize that outcome to make these patients feel better. What are some of those pearls you found?
Well, I think that unfortunately, many of the patients that come to see us have been through the conventional medical system. And so they've been suffering for a long time in many cases, with their pain, with their injuries. And in those cases, because of the chronicity, it takes some effort for us to repair those tissues to get them better. And so you have the structural piece, which, a lot of the regenerative treatments are great at improving. We can make the diagnosis, we do a good history, good physical exam, we can isolate on ultrasound, we can get the regenerative graft or whatever it is that we're injecting to that area very accurately. But what started it in the first place? Do they have some postural abnormalities, or do they have some type of inflammatory physiology that's going on that makes them more vulnerable to develop chronic tendinoses and things of that nature? Now, I myself, I am not an integrative medicine practitioner per se. I've worked with some very good colleagues who are experts at that, and I see the results. You have a patient that comes in with Lyme disease or chronic Lyme, and they've got inflammation all over the place, and then now they can get that inflammatory piece down lower such that the regenerative treatments work better. As a DO, again, as an osteopathic physician, looking at the structure and function and looking at optimizing their body alignment such that they don't always have that hip rotation, which is causing stress on that right gluteal tendon and resulting in that tendinosis, such that once I repair it with a regenerative treatment, it's hopefully not going to come back, or it's going to take a long, long time before it comes back because you optimize their symmetry and biomechanics. So that's just my short, and limited experience there. But
yeah. I think physical therapy is one of those tools that, most patients who come to me have tried physical therapy and it didn't work, and re-envisioning or having the right physical therapist to refer to who really gets regeneration and gets supporting someone through, injury healing, has been a game changer for me. I'm just launching a new physical therapy department as part of my practice because I refer to a number of different PTs, and my patients do better when they're getting to rehab after our treatments and before our treatments. They do so much better. I know you do a lot of even more than what we've talked about. What are some of the things
I think that integrated model is so critical. When I first started, I was really excited to bring fitness and weight loss to my patients because I just health in general, getting a healthy protoplasm, they're going to heal better. So I first started just adding some weight loss and some fitness and some healthy nutrition plans and getting them eating well. Then we started saying, man, we should add some supplements and some health coaching. And then we started saying, get diving deeper into the functional medicine side. So whether you do it in-house or you refer, it's integral to those outcomes because when they're losing weight, they're eating better, you optimize their regenerative potential through anabolic hormones. Mm-hmm. It's really amazing. I think in physical therapy, just that functional movement standpoint is so, so important. So I totally agree with you guys with that one. An integrated model is really what is needed. The other thing I found, through starting a practice, I think all three of us are independent business owners at this point. So we have to juggle learning these amazing skills, keeping up to date, being proficient, not injuring patients, because my greatest fear in life, and as a teacher for 20 years, is I teach what not to do as much as I teach what to do. But also, man, how do you start a practice? How do you hire? How do you fire? How do you balance the budgets? I mean, there's so much that is needed from a business perspective. And part of our goal with getting these conferences is when people come in, we're going to teach them some amazing skill sets. But at the same time, we have to teach them to run a business, to keep the doors open so that these amazing services are available. So tell me a little bit about you guys' journey on the business and medicine side, because if you're going to do this, you almost have to be independent.
Yeah. There are few of our colleagues who do this in, employed medicine, and, growing. Thankfully, some organizations are open to it, but very few. And for me, I took over a practice when my predecessor retired, and then I realized I had to grow that, to be able to support my family, but also as a mission the more people I helped, the better I felt about, my role here to heal patients. And so I didn't know a thing about marketing, right? And then, I was doing my own bookkeeping, and I realized I needed some help with that. Hiring people, was challenging. So when that was the main reason I came to the first conference that you put on in Wake Park was not your first conference. The first one I came to was like, I need to figure out this business stuff. And so finding other like-minded individuals who are doing it already, doing it super well at a high level of integrity, it's like, this is where I need to be. I need to be around these people. And for me, I mean, it has been exponential growth of my practice every year because the folks as part of the HR, the marketing, who are part of the Regenerative Practice Accelerator, RPX, like those folks were the ones who were mentoring me through how do I get through COVID? Yeah. How do I find a good person to hire for this, role in my practice? And these are things that we don't learn in medical school.
I'm gonna say I love being a doctor. I love talking to a patient. I love being a detective, figuring out their pain, having this toolbox of things that I can present to them. I don't love balancing the books. I don't love, being the marketer or having to hire someone. I hate firing people. I'm too nice. So it is nice to understand that stuff. Now, Dr. Wang, too, you've done this yourself too. You've had to go independent and do your own thing. What have you learned with that, and how do you balance both of those things, being a doctor and a business owner?
I think that, boy, if there's one thing in our medical training that is just sorely missing, it is training and education on how to run a practice, run a business. It's almost embarrassing that it's completely missing in many cases from medical education. I think that for me, I had this sort of like gradual transition in a way in that I started off in an academic outpatient practice, then transitioned to an employed doc in a private practice, then independent contractor, then kind of business owner. This is now my second clinical business, and so being able to pick up little pieces as you go. I mean, certainly you can start right off the bat, like private solo practice and just hit the ground running. But boy, are there a lot of lessons to learn along the way, I think one of the key pieces, though, is to have a resource that's going to be able to help you with all that stuff. And there are a lot more resources available now than there were back then. But, are they organized? Are they all in one place? And so that's something that I think that we're, trying very hard to develop, right? Because we've been through these trials and tribulations. We know what's missing. We know it was difficult. And we don't want that future generation to kind of have to go through the same trial by fire that we did. One thing that I talk about, not just from the business perspective, but also the clinical perspective, is if it took me 15 years, right, to learn. Now I'm closer to 20 now, but I'm going to try to ignore I'm getting older here. But 15 years to feel comfortable with most of the aspects of practice management and most of the aspects of what I do clinically. If I can train someone else to do it in 5 years, 5 years is still a long time, but that's still 10 years less than it took me, right? And can you think of the impact that has, like from one generation to the next, where if you can train a group of great physicians and medical providers in 1/3 the time to do what you can do, and then that propagates out for 10 generations, you will change the face of how medicine is practiced, right? So I get really excited when I think about that. And so I think that having a centralized repository almost of all the main, most important, efficient things that you need to know in terms of running a practice and performing clinical medicine, that's where it's at. Try to, bring it all together.
Yeah.
When you said that, it made me think about how many of my colleagues and friends who are in employed HMO-based or large system-based medicine are really happy with their practice. Very few. Very few. And getting worse, right? Yes. Just constantly getting worse because of those time pressures, because of those lack of actual control of what's going on in their practice, more of the meaningless, menial tasks that they're required to do. And I'm so grateful to be in independent practice. And I have a lot of friends who are kind of looking on, like, is it going to work?
Yeah.
Oh, it is working.
Yes.
Maybe I should think about that. And I think is one of those pendulum shifts that we're seeing happen. More and more docs are going into independent practice. A lot of direct primary care doctors, are more independents showing up in my community, and it's wonderful because it's the right way that medicine should be practiced. The decision makers should be the ones who are the care deliverers. And I think that we have an awesome opportunity as we continue to teach, right? It's so fun to watch that progression of our learners, not only in the medicine, but also seeing that freedom being developed, that they can really truly treat the patient the right way, not the way they're being told to.
Yeah, you say the word freedom. That's the same word that came to my mind thinking about this question, because like once you taste freedom, you can't go back to the oppression of having to see 10 more patients a day, or only get paid what this code is going to bill out, or having to work harder to be paid less. As an independent physician, you have the creativity and the ability to create whatever you're able and want to create. And I think that's part of our passion with the RPI and with our MedFit vision, is to bring doctors in, walk beside them. I've heard you say the word family, and when we come together with these like-minded individuals, I love these weekends of getting together, because it's like immediate friendship, immediate kinship, immediate like, yes, this is the way healthcare is supposed to be. And we give all of these attendees and physicians the ability to do this, and to do it within a couple years time frame, not the 10, 15 years it took all of us to do it. And one curious thing I'd be having on closing here is, one kind of pearl or message you'd give to either that physician that's just coming out of residency or fellowship, or that physician that's been working for 10 years, like, what, I don't want to live under this oppression of 20 patients a day and my cap of earning is here. What message would you give them?
Well, I would probably say that you don't know what you don't know. And, I did not have any exposure to private practice during my training, not during medical school, not during residency training. And had I had real exposure to independent practice and regenerative medicine, I would have went right into that. I would have been pursuing that so hard. And so I think for someone coming out, someone in fellowship, someone in residency, or early in practice, like maybe just seek out some of those providers around to say, hey, could I shadow you for a day or two? Can I get to know what your practice is like? Because I think had I tasted that earlier, I would have been 100% in. It would have been hard to see that freedom and go the opposite direction. Now, independent practice, it's scary, right? There's a fear factor, and then the other thing, if I can say two things to do: one, get exposure, and then two, find people to do it alongside it, because it actually turned out it wasn't all that scary once I had other independent practitioners who I saw doing it and doing it at a high level that also said, come alongside, let's go. We're going to do this. I'm going to help you. And to have that partnership, that family to do that with, all of a sudden that fear factor kind of went away, and I was like, okay, it can be done.
Yeah.
And here's someone who's showing me, here's how to do it. Let's do it together. Yeah.
It's comforting.
I would love to dovetail on that fear factor piece. So, as a kind of pearl, I would say, be not afraid. Or I'm thinking of trying to quote Yoda as well, and something like this. But fear is such a powerful, just like motivator or paralyzer in our lives as human beings in general. And I spend a lot of time thinking about this, and a lot of time talking to folks about being okay with being vulnerable. And in this particular scenario, as physicians, as new physicians, we are dealing with, I don't know, maybe you could call it some trauma, almost like emotional trauma of our training. Our training is not easy. And so you come out of residency and you're like, holy cow, I just survived residency. Now I got to worry about, starting a practice somewhere. There's all these things that I still don't know. I feel like I haven't known what I'm doing since first day of medical school. How can I not know what I'm doing for all of these years, right? And then the second thing is, for more experienced physicians, they may now have some confidence in terms of where they are in their practice, but could they be becoming overconfident in the sense that they are actively avoiding learning new things? Because once they open the door to learning a new thing, they're going to feel like they don't know something again, and it's like there's that past trauma of their previous training where now they're in a situation where they don't have as much control. They don't know exactly what they're doing. Can they get over that fear? And I would encourage people to really feel okay with that vulnerability, because the world of regenerative medicine, it is a different mindset. It's a different paradigm, but it's so beautiful because it opens the doors to learning so many more new things. And it's the same thing with contract reviews. I was just so scared of contracts when I was early in my career, and I ended up not hiring the right legal teams to review contracts. I just kind of trusted the person who wrote the contract, and I ended up not getting a good deal, in terms of that. So being not afraid to look at contracts, learn about them, learn to interpret them, hire legal help to learn, and then also the business aspects. Like, don't be too afraid of oh my gosh, how do I process payroll, or how do I, those sorts of things. So you kind of got to grab the bull by the horns a little bit. We're used to doing that. I mean, when anybody that survived, medical training, whether it's as an MD or DO or naturopath or other clinical provider, we've all gone through the gauntlet of that, and so this is another type of gauntlet, it's a little bit different, but it's going to yield such great results because now you're going to be the one in control. You're going to be the one that can provide the best care to your patient. So it's a more direct line to improving your practice, and therefore ultimately improving the care that you can deliver to people in your community.
Yeah, I think too, when I'm talking to someone that's new and wanting to take a risk, I always want to ask them, what is your reason for doing this? What is your why in life? What drives you? What's your passion? And if their passion is, I want to do something good for my patients, I want my patients to live with less pain, I want my patients to be able to do these things in life that they couldn't do before, which is pain relief. It's like, you can have the tools to do that. You can do that, and you can do it on your own. You can create a model that's amazing. You can provide for your family. You can do it independently. And that's what I've loved over the last, 10, 12 years of physician training is teaching them that they can do it, because so many people, and you're right, you can't do it alone. And I think the best advice is, find a group, find a friend, find mentors that can do it with you, and do it efficiently. And your investment will be very small, and the payoff's going to be very big if you're wise in the way you do that. So I just thanks so much, you guys, for hanging out and chatting a little bit today, and look forward to really changing healthcare with you guys in the future.
Absolutely.
Thank you for the opportunity. It's been fun.
Yeah.